Welcome back to another episode of The Physician Gardener. I am Dr. Kashidi Long, your board certified internal medicine and lifestyle medicine physician, and today we're going to be talking about some foods that help with high blood pressure. To start off with, the number one food shown to help with high blood pressure is beets or beetroot juice. 8 ounces of beetroot juice per day have been shown to lower high blood pressure in people with prehypertension and mild hypertension. It does this by increasing the nitric oxide in your body, which dilates blood vessels and helps with your blood flow. Number two is garlic. Studies show that aged garlic extract can lower blood pressure as much as some first line blood pressure medicines. So, when we are starting you on a blood pressure medicine, for any given medicine, we're expecting about a 10-point lowering in blood pressure. And so, some of the garlic studies have shown that garlic can lower your blood pressure 8 to 10 points. And so, that's an equivalent to a medication. Why isn't everybody using garlic? Probably because it's not standardized necessarily across all formulations, and so you have to find a good formula. And also, it's not considered a medication, it's considered a supplement, so it's hard to prescribe supplements, since people would be getting them from different sources. But it's something that you can discuss with your doctor about adding into your regimen to help you get blood pressure control. Some people don't like the garlic supplements because they can give you bad breath, they can increase indigestion, but it's something to consider. Now, does adding more garlic into your food lower your blood pressure? I'm not sure, but it certainly couldn't hurt, and it makes things taste delicious, so why not? Number three is olive oil. In the PrediMed trial that I believe was done in Europe, adding supplementation with olive oil, I think 1 to 2 tablespoons per day, was shown to lower blood pressure. I can't remember by how many points, but I will link the trial. So you might want to consider adding in olive oil instead of other oils. So maybe if you use vegetable oil or canola oil or grapeseed oil on your salads, or when you're roasting your vegetables or cooking your food, you can consider switching over to olive oil. If you use regular salad dressings, you can replace that with olive oil and vinegar, or olive oil and lemon juice, or olive oil and avocado, or not avocado, that's two fats, you don't need two fats. But you can make your own salad dressings with olive oil instead of store-bought salad dressing, which is likely using canola or vegetable oil, and get extra olive oil in your diet that way. Number four on our low blood pressure lowering foods list is actually not necessarily a food, but it is tea. Specifically, green tea and black tea have been shown to lower your blood pressure. I believe drinking 2 to 6 cups of tea per day is associated with lower blood pressure. And the longer you drink it, i.e., if you drink longer than 12 weeks, then you continue to see positive effects from this. I do not recommend going and getting the Arizona green tea or Lipton green tea that's pre-made in the store. I think you should brew your own tea so you know that it's actually tea and not other chemically supplemented items made to taste like tea. Also, the store-bought teas that are pre-brewed are generally full of a lot of sugar, so that is not what I'm talking about. I'm talking about making a cup, putting a tea bag in a cup and adding water and letting it steep for 5 minutes and drinking that. You can lightly sweeten it at home, but try not to do the pre-made store-bought teas. Hibiscus tea is also associated with lower blood pressure. And number five on our list is apples. You've heard the saying, an apple a day keeps the doctor away. Well, in this instance, an apple a day keeps blood pressure away. That's a bit of an exaggeration, but there was a study in 2022 comparing fruit consumption amongst individuals and blood pressure, and people with higher fruit consumption had lower blood pressure than the people with the least fruit consumption. So this was not just apples. They grouped it into bananas, apples/pears, and oranges/citrus. The apple pear group and the orange citrus group did the best, and the people who ate those at least 5 times a week had about 4 points lower blood pressure than the people who ate them less than once a week. So try and eat your fruit every day, or most days, to have a lower blood pressure. Let me know in the comments if you have any questions or if you have a suggestion for a future video. This is the Physician Gardener, also known as Dr. Kashidi Long, and I will see you next week.